Thank you so much for doing this, Scott. This was totally impromptu today, right? This was not planned.
It was not planned. I would have dressed much more presentable.
So tell everyone who you are and a little bit about yourself.
So I have lived here in Phoenix my whole life. I was born and raised here. I'll be 70 in about 4 months, which is hard to believe. I've got a beautiful family with 4 daughters that all have beautiful families, and we live in the Southeast Valley in Chandler, and we're quite active. We own a real estate company, and so just feeling really blessed these days.
So tell us why you're here. What brought you into the office today?
So as of today, I'm a week post-op with a left hip replacement, and coincidentally, 8 weeks post-op for my right hip replacement. So I've done a lot in the last 2 months with Dr. Gough and with Chris and this beautiful staff here.
So how did you find Dr. Gough initially? Tell us a little bit about that story.
So it's really a great story, and one that I think really reinforces the quality of this staff and Dr. Gough. I have had 4 joint replacements. The first one was 10 years ago. That was my right knee. And I started rehab in a facility in Tempe that I was introduced to by a very close friend. So that's where I did my post-op rehab for the right knee replacement. And I worked really hard in the rehab and got it back to great condition, and it was very successful. And this particular physical therapist, who I became very close friends with through my involvement over there, we started to socialize together. I introduced him to a lot of my friends, and he was just this great guy that always kept all of us informed as to who the great new surgeons were in town, because a lot of their patients would end up being at his clinic. And we were at lunch 2-3 years ago, and he walks in and he says, "Okay guys, I got the hot new surgeon up in North Scottsdale that you need to know about, and if you need any orthopedic work, you got to at least visit with this guy, because his patients are coming to our clinic and they're all light years ahead of all the other patients coming in." Mm-hmm. Can't believe it. Great. Well, as luck would have it, about a year later, I was having trouble with my left knee, and I had been told when the first one was done that I was going to eventually have to do this one. Just didn't know when. Well, it started falling apart. So I thought, well, I'll go see Dr. Gough. And I came to see him, and within 2 minutes, I knew he was my guy. And it was just a great session. I was so impressed. Got out the calendar and scheduled the procedure. And it's perfect. Again, I work really hard in the rehab clinic, and I'm such a believer in how important that is. Not everybody does, but it's worth it. And when you got a great surgeon and you really hit the rehab and be dedicated to it, you're going to have great results. So that's what I did. And then 6 months ago, I had reached the point where I felt both my hips they felt arthritic. And so I came to see Dr. Gough, and he had me do the x-rays. He looked at the x-rays and he said, "Yeah, both your hips need to be replaced. Here's why." And he showed me all the reasons. He was very methodical about the way he explained what was going on in my hips. As was Chris Barrow, and Dr. Gough's PA, and I've also become friends with, and who I'm extremely impressed with. They're such a great team, and they make you feel so at ease and comfortable and confident in the procedures and the probability for a great outcome. So we scheduled both hips, and I was told that the hip replacement procedure was nothing compared to knee replacements, but I didn't expect the experience of both procedures to be as pain-free and easy as they were. In both situations, I was off the walker in less than a day. I was walking normally in 3 days. And there just wasn't any pain. And I don't understand that. It was beyond my wildest expectations. All I know is there must be a really talented surgeon involved to have that kind of an outcome. So I'm a crusader for Dr. Gough and Gough Surgical, and I've sent friends here that have also had replacement procedures done with marvelous results. They can't say enough about him, and I'm sure there's more coming. So I just can't say enough about his talent and of both him and his staff. I just feel truly blessed to have found Dr. Gough. You know, when you make those kind of recommendations to someone that you really care about, and you know that how concerned they are about quality of life and wellness, and it makes you feel so good to be able to introduce them to someone that can really bring that into their life. And they've all had marvelous results, and it didn't get much better than that.
Thank you so much. That was great. All right. Thank you, Scott. I've got one last question for you, just because I'm curious. What advice would you give someone who is watching this video, might be scared about getting a surgical procedure, or is kind of on the fence, not really sure? What advice would you give someone like that?
Well, I've had several friends that are in that frame of mind, and it's understandable, because I mean, just thinking about it and all the unknowns, you don't know what to expect. And so I think the natural tendency is to just avoid it, put it off, keep taking Advil or cortisone injections or whatever it is that's getting you temporarily month to month. But I know that as we age, arthritis is a real thing. The beautiful part of where we are today is that the technology is now so advanced from where it used to be, and I've studied it, and it's so impressive, the game changer that's become. And when you couple that with such a talented surgeon, you're going to have great results. And so I tell that story in a pretty compelling way, and I would just advise people, don't avoid it, don't put it off. Take that first step and talk to a surgeon that comes highly recommended. Just have the conversation. And I think they'll put your mind at ease and make you want to understand more and learn more. You'll get there. And then, as almost everyone does that goes through the procedure, the first thing they ask themselves is, I wish I had done this sooner.
Mm-hmm. Yeah.
And that'll happen.
Thanks, Scott. Thank you so much.